Thank you. Over to Dr. Bharat.
Thank you,
Over
sir.
to Dr. Bharat.
Yes, sir. Thank you, sir. I once again welcome all of you for the share series, Karnataka Homeopathic Medical Association free webinar for today. Now, I would request the senior homeopath of Karnataka with a vast experience of 36 years in the field of homeopathy, Dr. Madan, sir, to take over today's session. Over to you, sir. Yes, sir.
Thank you, Dr. Bharat, and good evening, everybody. First of all, let me thank the KHMA personnel and the today's audience for giving me a chance to share my experience regarding the homeopathic management of the acute conditions of the present season. Now this rainy season, as we are seeing the more of viral infections like dengue, cholera, malaria, the chikungunya, and influenza. In my experience, as now we are seeing, there are more of loose motion cases, diarrhea cases. And particularly diarrhea is so exhaustive that the diarrhea is completely watery. And there is more of gurgling in abdomen along with the watery loose motions. In such conditions, we are seeing the croton tiglinum bringing down the control of the loose motion based on the type, which is very watery, gushing and gurgling. On this basis, the medicines are selected and they are coming down, plus this rainy weather effect, where you can see even the natrum sulph. By giving mere natrum sulph, the loose motion is not coming down. So we are giving natrum sulph 1 ml 2 hourly and the croton tiglinum in water every 15 minutes is bringing down the loose motion and making them normal. As many times one medicine works like a catalyst along with the other medicine, natrum sulph is removing the effect of this weather condition and the croton tig is correcting the type of loose motion. This is one thing. Now regarding the dengue, if you study the cases of dengue, chikungunya, malaria, in all these places, what we are seeing the common is fever with chill, bodily pain, exhaustion, diarrhea, and in such cases, in some cases we are treating with on the basis of symptomatology, and in some cases we are treating on the basis of the lab investigations also. When in dengue cases, many times the dengue profile, when it is done, it is negative, but we are seeing the platelet is coming down. In such cases where there is the lowering the platelets, where the patient is very, very tired and much debilitated. This much debility has given the suspicion of reduced platelets. So after checking after checking the blood, we found that the platelet is coming down. In all such cases, the Crotalus horridus is helping to improve the platelets in overnight where we had to give the Crotalus horridus frequently. Frequent stimulation of Crotalus horridus by the Crotalus horridus, where even when the platelet had come down to 20,000, in overnight it has increased to 80,000 and later on more than 1,25,000. So Crotalus horridus is helping in many of the dengue cases as well as dengue negative cases, where the medicines are selected on the basis of platelet count. Now you must have seen in majority of cases, all are becoming worse after the vaccination, COVID vaccination. So in many cases, when we check the blood, where the platelets were increased, it has gone more than 7 lakhs also. See, we know that it is the platelet factor that controls the clotting and bleeding time. So after seeing this, we suspected even this clottings may be due to the increased platelets. And in many cases where the vaccinations were over and after the vaccination, their condition, their immunity has come down actually, and their general health has decreased. Because of that decreased general health, they were easily getting affected to this rainy weather with increased platelets. So after seeing this, if you read Cordus Marianus in Murphy, he says it affects both liver as well as the spleen, cardiomegaly and splenomegaly, both calcarea ars as well as Cordus Marianus. But since we see many of the cases where there were more biliousness, after giving Cordus Marianus, we are seeing their platelets is coming down, their fever had come down, liver profile, where there was a slight variation in the SGPT and SGOT, also could be corrected after seeing the blood report. Cordus Marianus could be used to reduce these problems. In some cases of dengue fever, if you study Rustox, if you study in Clark or in Murphy, in the clinicals, he says it covers dengue, it covers chickenpox, it covers herpes, it covers influenza. So in such cases where there was a which had the complaint had started as cough, cold, fever, or rather the hay fever, and which led to the severity of the temperature and severe headache, which had started particularly after the drizzling, because Rustox covers the effect of drizzling. And since what are the conditions now I told, the dengue, the arthritis, or the influenza, or the chickenpox, herpes, all these things are due to the viral infections. Of course, we know the virus cannot affect us unless we are susceptible for them to become active. This susceptibility could be corrected with Rustox. Even in dengue cases, we are seeing after giving Rustox, the platelets has improved, dengue has become negative. In remote places, when they got the dengue, when we got the information that the patient is having dengue and could not get the medicine there, the Rustox, the natural order of Rustox is anacardiaceae. Your cashew nut is also an anacardiaceae. So we had asked them to chew a small bit of cashew nut, chew well for half a minute, and to drink a small tumbler of water, to do it every 2 hours in mild cases, and to do the same thing every half an hour in severe cases, we could get the result by the cashew nut. So we need not worry that when we reach the
Sir, it's just unmute, sir. It's got muted.
Are you hearing? Hello?
Yes, sir. Yes, sir.
Yes,
It's
sir.
audible.
Audible.
Yes.
So till now you are audible?
Sir, it was audible. Audible.
Okay. So in such cases, we have helped, we could help with the cashew nut instead of rustox. Usually in this weather, with the cloudy weather, effects of cloudy weather get corrected with the dull camera. When the effect is from the drizzling, rustox helps. In heavy raining, the natrum salt helps, depending upon the cause. But on the when there is an effect, and when we find a different symptoms, as we know, different symptoms indicates for a different medicine in our materia medica. So in some cases of cough, cold, fever, bodily pain with severe nose block, the dull camera helps in this weather. See, the stuffy nose, over burning heat and high temperature with headache and heaviness is typical dull camera. Whereas in rustox, you will find more of bodily pains and muscular fatigue, and better, as you know, rustox better by movement, and the effect is from the exposure to the drizzling get corrected with rustox. And of late, because of this weather, and which is favorable for all the viral infections, and now you can observe as there is a wave of COVID, where if you find that symptoms, if you observe properly, the new wave is with more of the waist pain and bodily pain, particularly bony pains getting corrected with Eupatorium perfoliatum. In acute conditions, you can even repeat the medicines every 15 minutes in water, so that the frequent stimulation of the body helps to get rid of the acute conditions. Because why I am telling this is, some students have the wrong idea that by repeating, they may start prove the medicine. When there is already a complaint, they cannot prove the drug, because the drug has the work of removing the complaint, not producing its own symptoms separately, where the proving can happen only when excess medication is taken in a completely normal or healthy person. So in acute conditions, you need the frequent repetition, and you can repeat in water every 15 minutes. In some cases now, what we are seeing, one is due to the water contamination. There is more of throat irritation, where they have gone outside, taken some water or some juice, where they get the severe irritation of the throat, and then leading to the cough, cold, hay fever or flu. In such conditions, when it is exposed, when the cause is due to the intake of some water or juices outside, is getting covered with gingiber, because they say the gingiber can correct the effect of contaminated water intake. So we don't know what kind of water they use outside, or whether using the water, what will be the
Sir, it's again muted.
what kind of water they use. These things are not.
I request
Then
Dr. Nisarga.
One
Dr.
minute.
Nisarga. Nisarga has unmuted yourself. Kindly mute. Dr.
So
Nisarga
these-
Srinivas, please mute yourself.
So when there is the complaint are due to contaminated water or contaminated juice, or by taking melons, we are seeing the gingiber has helped in clearing such throat irritation, cough, cold, and fever also could be corrected with gingiber. In some cases, as we have seen, which is leading to the typhoid, which is of a slow onset and leading to the loss of orientation. In few cases of the present tendency, present viral fever, we could correct it with Helleborus, because it was leading more towards the loss of orientation and a sort of restlessness could be corrected with Helleborus. In some cases of cholera means it is more of a food poisoning that is happening, water infection and food infection, which is leading to gastroenteritis, could be corrected with camphor, because of the in most of the cases what we have observed was the complete coldness of the body, and particularly more with the extremities. So with this, where they had gone for pilgrimages and or touring or having food outside, in such places we could see the gastroenteritis, and with that there was more of a coldness in the extremities. So we had they had rang me up from that outstation itself. I told them to take a small piece of camphor, add 2 to 3 teaspoon of water, crush it well, and add 1 drop of that water to half liter of water and shake it well for half a minute, and start taking one sip. Start taking one sip every 15 minutes until they start feeling better, and they improved completely, and even the coldness has come down. In some cases of this gastroenteritis, we could see even the cramping in extremities, where the cramp was more predominant with the loose motion. So we could correct them with cuprum aceticum. The difference between cuprum aceticum and the camphor is, you will find more of cramps in cuprum aceticum. You will find more of coldness in extremities, and also the cold sweat with the camphor. In some cases, now we are seeing even the pneumonitis. In such cases of pneumonitis, particularly where with the elders and senior citizens of late, one is due to this weather, second is due to the indiscriminate use of this COVID vaccination. In such places, we are seeing a small piece of carrot could help relieving their congestion, and we ask them to chew a small piece of carrot for half a minute and to drink a small tumbler of water. Along with that, the ambrogracia is helping in majority of the cases of late, where they, after the onset of this COVID, with ambrogracia, we could help them to get rid of their congestion and also the general weakness. If you read Murphy, if you read ambrogracia in Murphy, he says multiple organs affection in old age, he says. So on that basis also we have prescribed ambrogracia because the majority of the senior citizens were getting affected, and the ambrogracia could help their congestion and wheezing and even pneumonitis, and many where were they hospitalized on account of this lowered oxygenation. We could correct their congestion in the chest with ambrogracia, and they could be discharged from the hospital. The carrot is Lomentum dissectum. In
Sir, it got muted. Unmute, sir.
1 minute, there is a disturbance from our dog, so just I muted.
Yes, sir.
1 minute.
Not okay, sir. Not an issue.
The other drug which were helping this chest congestion is Lomatium dissectum. In 1918, when there was a widespread of influenza, there was an epidemic of influenza in a colony of America, North Nevada. No one was getting affected with this epidemic of influenza. So when an MD doctor examined that area, who is an MD doctor, Dr. Kreb, who after observation found that they were all using the carrot juice. So because of that, there was not even a single case of death from influenza, or there was not even an affection of influenza in that colony. So on this basis, on this information, we thought why we should not give an, because Lomatium dissectum is an Indian carrot. We used to ask the patient to chew a small piece of carrot and to drink a small tumbler of water every 2 hours. This also has helped in many cases of influenza to get rid of their problem and get discharged from the hospital. In some cases of this weather, we are seeing that there is a slight consolidation of the chest, or the, rather consolidation of the lungs. So that consolidation, if you read the Chelidonium in Murphy, he says hepatization of lungs. So that hepatization is nothing but the consolidation of the lungs. Even in such cases, we could get rid of the consolidation by prescribing Chelidonium and Rustox in alternation or together, where the Rustox has taken care of the viral infection. Chelidonium was correcting the lung consolidation, and we could get the faster relief. Mr. Jayan, I think now if there is an interaction with the attendants, where if they have any doubts or any problems they are facing, I think that will be of much help in when we exchange our ideas.
Yes, sir. Is I mean anything left out, sir, from your side? You want to continue? Or?
Nothing. I think I have completed it.
Okay, sir. Okay, we have another 8 to 9 minutes left in the session. So
Okay.
any of the doctors or students who have any doubts, you can put it on the chat box so that I can put it across to sir and sir will explain. Okay, so you can use the chat box. Okay, all the participants can use the chat box. Sir, there was one question earlier.
Yes.
Kindly please repeat the difference between dull camera and rustox in terms of rain and drizzling.
See, in dull camera, there is more of nose block, running nose. With the running nose, there is severe nose block and more of heat and fever in the dull camera. Whereas in rustox, there is more of headache and bodily pain, and the muscles are more fatigued and they feel pain in the muscles than in dull camera. Both. Whereas the dull camera is due to the cloudy weather effect, whereas rustox is due to the drizzling effect. With all these things, you will find similar symptoms in Eupatorium perfoliatum. But whereas in Eupatorium perfoliatum, you will see more of backache like rustox. But in rustox, you don't find the bony pain, whereas in Eupatorium perfoliatum, you will find the bony pains. But all the three will work in a viral infection.
Fine, sir. Thank you, sir. There's one more question is, in cough after influenza, within how many days we should expect relief? Any home remedies for the viral cough?
One is the cashew nut, as I told. Another one is the carrot.
Okay, sir.
So to chew a small piece of cashew nut and to drink a small tumbler of water every 2 hours will bring the resistance even to these virus. So just I will tell you an example. My sister who worked among the active COVID patients more than 2 weeks, looking after her sister-in-law without gloves and without mask, chewing a small piece of cashew nut, her test was negative even after that. So cashew nut has the capacity to bring resistance to all these viral infections. Yes, please. Next.
Sir, yeah. One, sir, for hand, foot, mouth disease in children.
Mouth disease.
Yes, sir.
Best remedy is calicloratum. Calicloratum and echinacea. You can alternate calicloratum morning and evening and echinacea noon and bedtime. If there is already pus formation in the foot, if you see in the foot and mouth conditions, there will be more redness of the mouth and the redness between the digits of hand and foot. So there the calicloratum will help. And if there is more of itching and the septicemic condition with that foot and mouth, echinacea is getting the relief. And of course, now you can see there is a monkey pox. There is a spread of monkey pox. If you see the symptoms and signs of monkey pox, your Kali bike will help that condition, because Kali bike could correct even the smallpox. Now we are seeing the pus-filled, white pus-filled vesicles which get cleared with Kali bike. It is typical Kali bike symptoms if you study. Yes, please. Next.
Sir, question is nose blockage.
Normally, how many days?
Yeah. Yes, sir. Normally, how many days post-viral cough will last?
Post-viral cough works depending upon the type of the cough. If you prescribe, we are seeing within a day, the cough is coming down, particularly of late. Because of this vaccination, after the viral fever, cough is very severe, which is getting corrected with spongia, because Now you must have read in the paper that after the vaccination, TB cases are more. Spongia has capacity to correct the pulmonary tuberculosis. On that basis, we are seeing even the cough is getting clear by Spongia. Rattling cough and fever during this weather, which medicine will cover? You must have read the, see, with this, if there is a more of rattling and when they find difficulty in bringing up the phlegm, your antimptort will help. With that and congestion in the chest, and if there is any burning in the chest, you ask them whether there is burning in the chest after coughing or while coughing, your Seneca is the indicated medicine to relieve immediately after the viral fever. And if the same thing persists with the pain while coughing, it is bryonia that brings down the cough. In bryonia, you get pain while coughing. That is why the patients hold the chest and cough. Whereas in Seneca, after coughing, the patients hold the chest to control their burning. So Seneca will help if there is burning during cough. Yes, please. Next.
Sir, there's a commonest question is night aggravation, sir. Most of these nasal, post-nasal drip, you have sneezing, we have nose blockage complaints, night aggravation.
Or more at the night.
Yes, sir.
If the nose block and severe and running nose block, your ammonium carb will help in relieving the nose block. If the nose block on both the nostrils simultaneously, it is ammonium carb. Or if it is one side, while lying on one side, the other relieves, but one gets stuffed up, is with the ammonium mure. And if the if nose block with running nose, then your lemna minor will take care of the nose block and also running nose. Only nose block is more, then it is ammonium carb. And if the nose block with the cough, worse on lying down and has to sit up, we are seeing CPR in lower potency like 200. It is helping them to relieve their cough as well as the many times even wheezing, cough and nose block and hay fever, which is worse lying down, better sitting up. Even while sitting up, you just inquire whether they sit straight or sit bent forward. Sitting straight is CPR, okay. So bent forward, the Kali carb is helping to get rid of their problem. Yes, please.
Any other questions? We have last 1 minute left, sir. I think we'll wind up on this session. Any other doubts just before we close? I think no more, sir, no more doubts. So I would like to take this opportunity to thank Dr. N. Madan, sir, for once again being a part of our association webinar series. Sir has been a part of our association since the birth of this association. I again wholeheartedly thank you, sir, for enriching our knowledge, especially when we think of acute complaints. Yes, of course, being a homeopath, it has been a difficult task as a hanger homeopath for us to treat such cases. Such hints or knowledge is very much required from the senior persons. So I once again thank you, sir, for taking up today's session.
Thank you.
We will be looking forward for furthermore sessions in future. I thank the president of our association, Dr. Veer Brahmachari, sir, for bringing up this session for today. I also thank Dr. Rajesh, sir, the working president, Dr. Niranjan, sir, our general secretary, and Dr. Jayant AB, sir, our vice president,